Services Committee. Attendance?
Mrs. Geiger.
Here.
Ms. Vedder.
Here.
Mr. Ruiz.
Here.
Mr. Steingart.
Here.
Mrs. Labuda.
Here.
You are five.
Okay, thank you all for coming. November is National Adoption Awareness Month, and we do have a proclamation that I will read when Ellen brings it in. I included public comment before we go into our agenda, just in case anybody comes with anything to input into the meeting. So is there any public comment now? Okay. We'll move into our reports. The Fraud Investigation Team update by DA Farrell.
To give you an update, we are now at full staffing. We hired our last investigator, Investigator Watson, came on board September 15th. Investigator Brownstein came on board in May, and the ADA who we hired, Grace Woody, came also on board in May. We have resolved all three employee cases. All three employees that were arrested have pled guilty and have been sentenced. With respect to the Conklin investigation, Darlene Conklin pled guilty to felony charges. She was sentenced in September, on September 8th, for official misconduct and offering a false history for filing in the first degree. She's been ordered to pay about $5,500 in restitution. She's been placed upon probation. George Conklin, relative of Darlene, also worked in the department, also pled guilty to felony charges, including official misconduct and filing false documents. He had defrauded the HEAP program. He has been found to have an intentional program violation. He's also been ordered to pay back restitution amount of about $1,300 and placed upon probation. Rhonda Roach pled guilty to a misdemeanor of official misconduct, again relating to her duties as a employee of the department, and was sentenced on August 21st to 3 years of probation. There was no restitution involved in that. She resigned her position with the county. So those cases are wrapped up in terms of that internal investigation for the employees, all having been found guilty, pleading guilty, and now being ordered to pay restitution and probation sentences. We are currently, since the initiative started, we're at 79 arrests. The total of public assistance amount alleged to be stolen as a result of those almost 80 arrests is $105,000. Food stamps, the total is $115,000. Medicaid, the total is $260,000. And HEAP is about $10,000. Child care as well, hovering right around $10,000. We have currently active about 30 prosecutions pending right now in the criminal courts. That is a tremendous change from where we were before all this started, because before all this started, we didn't have any. So we are continuing apace. Investigator Watson is coming up to speed. There's also, in addition, I mean, there's been some I guess, some criticism of the fraud team, in that we're going after folks who are poor and who have no other means. That's not true. We're going after people who are criminally taking advantage of the systems that have been put in place for the poor. And that money should be going to people who need it and not to people who don't. If the amounts are small enough, we do not initiate a prosecution. We have a standard non-prosecution agreement, which we enter into. This is done. This is best practice, quite frankly, in other fraud initiatives. And we enter into agreements with folks to pay back the money if it is in amounts which do not rise to the level that we believe criminal prosecution is warranted. So we are, and again, the DA's office is actively engaged in that process to make sure that that criticism that I have heard does not become a reality. We don't want that to be the case. We want to make sure that this program is done to preserve these scarce dollars to be used where they need to be used. So that's where we're at. We we will continue with this legislature's direction to continue this initiative and to make sure that Sullivan County is not a welfare destination, and that we're making sure that people who get these dollars deserve them. Simple as that.
The agreement for the payback of small amounts, is that to the public or is that to the employees? The number of arrests that you said, some of them were employees.
Yes.
Okay,
We
so
have three
what
right
I'm
at the top.
asking about is the agreement for the small amounts of monies. Is that to the people who were taking too much, that were public people?
Correct, correct.
Okay.
Correct,
Not the
absolutely.
employees.
No, in fact, the one employee got a $1,200, about $1,300. I mean, the employee steals, I don't look at it in that way.
Okay, I'm glad to hear that.
If it's a person who came in and then we look at the number.
Okay,
Yep.
thank you. Good job.
Okay, I had an opportunity to review the memorandum of agreement between the division, DFS, and the DA. And, just to kind of reiterate what Jim said, the purpose of the memorandum is to continue the ongoing investigation of welfare fraud by the Sullivan County Fraud Investigation Team. Collaborative effort between DFS and the DA's investigative staff. And the focus continues to be on investigating fraud referrals from DFS with access to information within the division. Recipient, provider, and vendor fraud is still a part of it. Summaries, which Jim has given us today, of all the fraud arrests. And, I think that with the success of the unit, I, just wanted to be sure that we were continuing the efforts, and I think DA Farrell coming here today and telling us that it's absolutely on target, moving full steam ahead. So I just want to, thank the commissioner and the DA and Jerry Dietz for working together.
Yeah, I just want to add one other thing to what you said. It is a collaborative effort, and we have met with nothing but cooperation, nothing with, it has been a partnership, and I want to thank the commissioner for that. They work very well with my team. I think we work very well together, and we will continue this, as you said.
And I just had one more question. Initially, when the fraud unit was pulled together, we had a effort with the law enforcement entities, the state police, the sheriff, the local police department. So is that still ongoing?
Yes.
How does that work, if you could just kind of explain?
My police officers cannot, we don't have a processing place, we don't have a live scan unit. So what we will do is we will collaborate with the police officers in the jurisdictions where these offenses are occurring. Perhaps they know information about these people that the investigators on the fraud team may not, and they're getting intelligence from them, and then processing the arrests and making sure that those departments are brought into the the arrest procedures. And yes, we're interviewing suspects at those locations with detectives and with officers from those departments, so they are still part of the collaboration.
So that's working?
Correct.
So it's working now.
But again, this takes it basically to a position where it's a focus. These investigators are dedicated to that. They don't do anything else. This ADA, that's all she does. All she does is
So the
fraud.
three investigators, with Jerry Dietz as the chief DA investigator, focus solely on the
Solely.
fraud, waste, and abuse, recipients, vendors, inside the division, outside.
Solely. They're not doing other things. So whereas in the past, again, we had that paradigm where, officers would catch cases or detectives would catch cases and they'd catch burglaries and rapes and, robberies and other things. These folks are dedicated to that. And we're seeing that they're making headway.
And can you say that this is a reason partially why maybe the crime rate is coming down? Do you see that as a piece at all?
Well, I don't know. I don't know whether I could say that this is caused by that. But I was talking to the commissioner before, and he's seeing some decreases in some of his numbers, which I think is a direct relation to the fact that there is a deterrent effect to arresting people for welfare fraud. Those who want to do it can be deterred by seeing that others are being arrested for it and then don't come in and do it. And I see some of the numbers are going down on that end, and that's a good thing.
Okay, and just one more question.
So it has a
About
deterrent effect.
the child support piece, I know that,
That's on hold.
is that set to move forward? Because I know there were 38 arrests, I believe.
There were a number of arrests that were made, and then the local criminal court judge in the village of Monticello dismissed them all. We have appealed that decision to the Sullivan County Court, and the decision is currently pending before the Sullivan County Court.
But I saw in the report that there are some recoupments of monies.
Yes, because what happened after those arrests was that many people who were behind on their payments and knew that they were potentially going to be targeted for arrest came in voluntarily and began paying.
And it was quite a sum of money.
Yes, we received.
And you're
Quite some.
receiving it monthly? Is that
Yes.
the-
Yes. That's another, again, a deterrent effect to arresting people. No one wants to be arrested. So if you know that you've violated the law and you think that you can get ahead of it, you get ahead of it. And that's what's
So it looks
happening.
like hundreds of thousands of dollars if I didn't.
I don't have
misread
that number. Maybe, I don't know. Do you have that number?
I think the number on the individuals arrested, that is one number, but I think what we absolutely saw was an increase from others who were in arrears of child support coming in and making payments.
I see. Okay.
Individuals who had not made payments
Okay.
in the past.
But the dismissal of the case could result in the exact
In the
opposite effect. That people now say, well, those charges got dismissed, they can't arrest me, and then they continue to.
Right, and
not
the number was,
make their
like
obligation.
5,000 in arrears? Is that number in the monthly report?
Our arrears collections went up 17%. Just, it spiked right after the arrest. We had people that have not paid in over 10 years all of a sudden start paying.
And so, just the implications of them paying, because families are dependent on the system, right?
Yeah.
So when they pay up, it's better for the families.
It's a win-win for everybody when they pay up,
Mhm.
county and for families.
Mhm. Okay, are there any other questions for Jim? Thank you.
Congratulations.
Thank you.
Good
Thank you.
job.
Yeah. I know you had business to tend to,
I do.
so, okay.
Thank you. Excuse me.
Okay, Division of Health and Family Services Monthly Report, Commissioner Parker.
So you have the pretty lengthy report in front of you. I'll just touch upon some highlights and then answer any questions that you may have. In the ACC, we have Shanoy Wellington, who is in her first month still of employment. The Family Council did sponsor a pretty neat unit decorating contest for Halloween. And then DFS staff did have their reinstituted their annual Halloween parade. So they were actually, the staff were able to actually go through the building, had a little mini parade in the building. I think the residents and staff enjoyed that quite a bit. I can't remember which unit they decided on won the contest. I think Barbara maybe. Unit 2 won the contest, so that was pretty neat to see. In community services, just note on the chemical dependency outreach treatment clinic visits, they were up by 177 visits from the previous year. We have, going to family services with foster care, we, at the end of this time period, had 88 children in the agency's custody. I believe that number today is actually 98 children in the agency's custody. There were 145 child protective reports during the month. That is pretty much, that's a little bit higher than the average, but it's important to note that 29 of those went to the Family Violence Response Team. And again, the Family Violence Response Team handles the about sexual abuse, physical abuse cases. So that's a high number for that unit to investigate. Going to temporary assistance, and this is also reflected in the packet in the monthly report statistics, the number of public assistance TANF cases being at 379, and public assistance safety net being at 283. Those numbers are both the lowest numbers that we have on record for quite some time, in the agency. And that was pretty much, you know, the high points within the monthly report. I don't know if there are any questions.
I have, if I may, on page 13, it talks about Sullivan County Adult Care Center. If I look at the occupancy rate, it looks to me like a good number that you got more private pay there, which I thought was wonderful. Funded positions, you had 18 and now it's down to 7, so I don't know what that's demonstrating. You needed less staff to do a better job. I'm not clear on what that amounts to. It's labeled number 13, it's
Right.
Okay, occupancy is the third box.
Right.
And it looks like you've increased the private payers,
Yes.
which I think is a great thing for the facility. Funded positions, it went from 18 down to 7, I don't understand.
Those are the vacancies.
Okay, so you filled the positions. Okay, and then if I look down at daycare, PT, OT, ST, is that physical therapy, or what are those letters for?
Physical therapy, occupational therapy, speech therapy.
Okay. So you have nobody now, or you got 5 people doing physical therapy, and nobody in the other 2?
Those are just the people in daycare.
Visits.
And that's
In
in
the
the daycare program.
Okay, thank you. Thanks for clarification.
So the marketing outreach continues, and maybe for November, we can get an update on, you know, how that's going.
Must be
Sure.
doing good if we've got an increase in the private pays.
What do you contribute that increase to?
Jeff. Our FAO.
Good job.
Wow. Morning.
Morning.
We were looking for you.
Jeff understands, you know, the finances.
No one
He's
took that
very
one,
much
put it
on
on
top of the financial condition of the ACC. And, in terms of collecting funds due, et cetera, has some good ideas. So I attribute that to Jeff.
Okay, and so maybe at some point, next month, you can give us an update on the efforts. I know the Family Advisory Council has recommendations as well, which I'm sure that they voiced those ideas and concerns, so.
I mean, just in going through with the parade, we had probably 50 DFS employees go through, and I was by a couple who had explained that, their moms or dads had been residents there, and they were amazed at just the physical plant and how it looked after the renovation. They just said, we're in a different place, and, I think the more people that we can get through the facility on tours, on visits, on open houses, I think the facility just speaks for itself now in terms of the, you know, physical plant and the rooms and the flat screens on the walls. I think we just have to get more people through. We have to just get the word out to more people.
No, I know I had a discussion after I met with the Family Council about signage through DPW, and I think they were gonna work on some of those pieces. Get some more signage at the end of the road and other places throughout the county. So do you know if that's moved at all?
I know Shinoy was working with, Ed McAndrew on that.
Okay. I know some of the signs still reflected infirmary, so, you know, there was a question of, where's the ACC, you know what I'm saying, so. Okay,
And then what we also wanna do is host, and we have, we have the contract, the county has a contract with the Zager Law Firm on collections. And what we wanna try to do is to get some either conferences or workshops on elder planning for the community at large, and just bring people into the facility and educate them as to, possibly their parents or their own assets, and just elder planning, things that really everyone should do, that, we're unfortunately coming across people at the point where they need that level of care, who have not had that opportunity to do that planning, and that financially can be catastrophic. So I think our whole marketing approach is going to be global, comprehensive, and some of it's gonna rely on the funding that is made available with print materials, with, public information announcements. I think there are staff going to a local radio station next week, is it, Jeff, to talk about the
excellent, okay.
facility. But it is, anyone who has not been there, I know that they will do individual tours, group tours, that really encourage them to visit.
Sounds like you're doing a lot of efforts toward that goal. Cora?
On page 4, with report and plan updates, it says coordinate an eligibility case review with examiners to review cases of individuals under work exemption due to medical reasons that resulted in potential cost avoidance. Can you explain what all that means?
I'm gonna ask Giselle to help me explain that initiative.
Yes, what we did was, as a result of a, site visit from Office of Temporary and Disability Assistance, our employment liaison had come out, and we are starting to look at a lot of the reports we have available to us. We printed all these reports that had to do with individuals that are claiming that they're work limited, and as a result, cannot work or engage in any work activity. So we coordinated a call-in of all those individuals. It's called an eligibility review. Under regulations, we have the right to call someone in and review their case. And if they're no call, no show, and there's no just cause, their case can be closed. It gives you an opportunity to send them for independent medical examinations if there's any question. As a result of calling in those individuals, we ended up closing 43 cases. The potential cost avoidance is a formula that's done through the Special Investigations Unit. When they close down a case, it's the potential projection of closing down that case and not issuing those benefits, what your cost avoidance is. So with the closing of 43 cases, that's the numbers that you see, and that's what the cost avoidance would be yearly, and then those were all safety nets, so if you took 71%, it would be the 214,000 in the local share that would be affected by closing those cases.
So are you saying that prior to the audit, this piece of work wasn't done?
Yes.
Okay, so now there is more oversight on whether the medical reason fits the eligibility.
Correct.
Okay.
Yeah, making sure there are different areas. You have like your 41, 42, so all the different codes. One could be that you're medically exempt for 0 to 3 months. We were looking at reports and seeing someone's been in that code for 10 months. So you wanna call them in, what happened, are you still on medical? A lot of people were already working, a lot of people, hadn't reported wages, so again, it was all calling them in, it was 3 examiners and a clerk that had the individuals coming in. We actually worked cooperatively with Legal Services of Hudson Valley that represented some of the individuals, so that was actually pretty good. It wasn't adversarial, and they came in to represent them, and we were able to determine, like, if you're really work limited, we're gonna put you in the right place, or, do you have to go to physical therapy? If you're going to physical, OT, any kind of therapy, are we getting those reports? So we were able to, that was very successful for us. The second one we're engaged in right now are individuals that are non-participating in any kind of employment. They're doing absolutely nothing. And individuals that have been sanctioned because they were not engaging in an employment activity. They're actually not getting any benefits from us, but when that sanction ends, they would end up getting their benefits again. That was, I think over 200 people that we called in, and initially 79 of those cases have been closed, but we don't have cost savings or any information on that yet, cause we still have 2 more dates.
So I'm just curious, if you had 79 cases and 43 cases, right? Were there measures to oversee the process before that weren't being followed up on, or are these new?
It's
New
it's
changes.
data. There are various reports that are available. With our employment person from OTDA, she's been coming down for 2 years now, working with us with our welfare to work program, reviewing that program, and then just working on people who had employment codes or codes related. That 41, 42, 43 code was, that's a long-standing issue with the agency. I think you can remember maybe 2 months ago, we had to increase the independent medical exam contract that we had with, I think they're Industrial Medicine Associates. And that is because we had folks who come to us who say they are disabled at the time of application and cannot work. And we have the ability to work with their physician providing that information or to ask for an independent medical examination. So it's an area that you can go back to times in which staffing was reduced, where you had staff who were focused on that population, that when those reductions occurred, the staff were not able to focus on that. With getting staff back in place, we still do not have the capability, the ability to do as much data analysis as we would like. Maybe it'll be, Christmas for us in the 2015 budget with some of that. We have, advanced some of those positions to be able to do that, but those positions are definitely, would save the county money in our ability to continue to look at and monitor certain codes, categories, eligibility factors. But the staff did a great job. The staff really, as a team and having these call-ins and really rallied together and did good work, and they liked it. And we want to do more with them with that.
Okay, another area of reform. Excellent, thank you. Looking at the monthly report, I just had 2 hopefully quick questions. Continue to work with Department of Corrections to reduce the number of parolees. Do you have an update on that, how that's going?
We essentially, the individuals that we have in motels are individuals released from New York State Department of Corrections. Our most recent issue is that our place where we have the individuals released wants to increase what we're paying per month, and has stated that he will refuse to accept those individuals unless we agree to that increase. So we're kind of, we're stuck. We have to do that at this point, because otherwise I would have to entertain conversations, et cetera, about where to house sex offenders. So I think the current delivery system around that, the sex offenders, the law enforcement approach, that's where we feel that the community is the safest with where the individuals are, but we are kind of being held a little bit hostage in that rate increase per month.
So what does it look like? Is it?
But the number is still, the total number of single individuals in motels, I just looked at it this morning, is 11. And I think most of those individuals are parolees from Department of Corrections.
Okay, but you see the process of the parole review committee, communication with the department?
Communication's great with the Department of Corrections, and we're getting as much notice as they can provide us in terms of the release date. There's always logistics with if they're released from Buffalo and they're on a bus, are they gonna get here during office hours, or are they going to then have to, get serviced by on-call staff? But, you know, there's still tweaks that we can make in terms of some individuals upon discharge will be eligible for SSI, Social Security, disability. If we could get that all done prior to release into the community, that would possibly avoid a motel episode. So we still are making, you know, revisions as we go along, but I think it's a lot better than what we were doing before.
Okay, thank you. Are there any questions about the parolee piece? And I just wanted to touch on the foster care piece in the monthly report, 88 children in foster care. I've gotten questions on, you know, in the past, we had, you know, numbers in the 20s in foster care, but now we see, you know, the numbers increasing. So can you just explain the transition from,
And at the time this report was printed, it was 88. Today, this morning, I believe it's 98. We have definitely filed more abuse and neglect petitions than in the past with our family court. We have removed more children that we have that are in unsafe conditions. So that is it is just, you know, obviously, and you'll see in the blueprint document, you know, the state and federal government, and we want to keep families intact, balanced with children's safety. And we have just had more situations where we deem the children to be unsafe in their home. And that has resulted in more removals from the home of children.
and so just so that I understand, being that we're trying to recruit foster homes, and we need more foster homes, the 88 children are being connected with their family, grandparents, aunts, uncles.
Right, some are
Mhm.
in placement with their grandma, grandpa, aunt, uncle, cousins, you know, to try to minimize that removal from their biological parents.
And prior to that, they were, I know I got several inquiries from school personnel concerned about children that were kind of in limbo. You know, they were in a questionable situation, and now they're being moved out, and placed with family as much as possible.
I mean, I think we always, we have communicated quite a bit at the end of last school year and the beginning of this school year with the school districts, with the larger school districts in particular. And unfortunately, you're always going to have, you know, a teacher or a guidance counselor who may, you know, feel one way, and because of what evidence, what situations that we have, we may not be able to remove, and they would like us to remove. I mean, that's kind of the nature of the business that, I mean, you see kids in certain situations and people would wish they could be somewhere else, but you're not able to do that. But I think what helps that is if we communicate better with the schools and, you know, in the process as to what we're doing, why we're doing what we can and cannot do.
Okay, and I think that segues well into, announcing that November is Adoption Month. And I'd like to read the Sullivan County Adoption Proclamation. Whereas all children in Sullivan County have the right to a home with a stable environment where they feel safe, loved, and supported. And whereas this year we focus on promoting and supporting sibling connections and the importance of maintaining sibling ties. Whereas there is a unique bond between siblings, research supports the critical nature of sibling bonds and their importance for children's development and emotional well-being. Whereas between October 1st and September 30th, 354 adoptions took place in New York State, and whereas in the county of Sullivan, 3 children have been adopted in 2014, 2 of whom were siblings and were placed in the same home. Whereas there are 6 children in adoptive placements. Now therefore, the Sullivan County Legislature proclaims November 2014 to be National Adoption Month and urges all of Sullivan County to join in the efforts to raise awareness about the importance of adoption. I think that number is a little higher currently, right? The number, it says here, 3 have been adopted, or 6 are in placement, is that?
I mean, there are 13 children whose parents' rights have been terminated. Some of those children may have a
That's
mark-
currently, right?
Right. So the children who will eventually be, you know, what the terminology is, freed for adoption, available for adoption, But I think, you know, during this month, what we try to tell people locally is that, who are interested in adopting, is that one way in which you will end up adopting a child is through the foster care system, through the child welfare system, by becoming a foster parent. And many of the children who are adopted in Sullivan County are adopted by their foster parents. So when you know, the 10 children that came into placement in the last month, chances are, you know, maybe 5 of those children are going to return to their biological parents, but the other 5 are going to need to be adopted. And, you know, we reach out to the community and we ask people, you know, to please step forward, consider foster parenting, consider adoption, you know, of kids locally who need permanent homes.
And currently, right now, there's an ongoing certification class being offered,
Yes.
Vicky, right? And you'll have another one in the spring,
Yes,
in April, right, it starts?
I believe so.
And is that like a 10-week course?
Yes.
Okay. And how long does the process take in itself, approximately?
We are trying to get the whole process done within that 10 weeks. They have to go through fingerprinting, criminal background checks, CPS history checks.
And that's within that 10 week, because when I was involved, it took a lot longer than 10 weeks.
It can take as long as 6 months. We are trying to do more concurrent planning. We're not necessarily waiting until they complete the training, but trying to get all of that work done while they're in the training. And I think
Okay,
in the
that's
past,
excellent.
we would wait for them to graduate from the training
Mhm.
and then start the process. Well, we're trying, you know, concurrently, you know, and it's an extensive licensing process. I mean, we make home visits, we ask for personal references, we, you know, spend a lot of time in the home, you know, if they have their own children to, you know, see the interaction, and, you wanna make sure you have people who are well-intentioned in becoming foster parents. So it's not a process where you wanna cut corners, but you know, if we do it concurrently, we're, going to be able to expedite, you know, the creation
Yeah, I
of
think
new
that's
homes.
really important, to get that process in a period of time, because you tend to get a little frustrated when 6 months, 8 months, a year goes
Yeah,
by,
and
so.
there's tons of research in becoming foster parents, and, you know, the research says, you know, you spend on average 1.5 years, 2 years talking as a husband and wife in a 2-parent family about it. One really wants to do it more than the other one. You know, finally, the one talks the other one into doing it, and when they call you, they want children tomorrow. Because they've been going through it for 2 years, and then they meet our process, and they become a little bit disenchanted, frustrated with the process, but we
Really
have
good.
to do that.
Kitty, you had a question?
Is there an average age? What is the average age of the child in need of foster parents?
I mean, right now, our split is, we have probably 40% are teenagers, and then the remaining are the 0 to 5 and the 6 to 10, probably equal, 25 to 30 children that are 0 to 5, and the same number are 6 to 10. But we have that nice, I mean, our teenagers are great, they're different than everyone else's. You know? But, you know, we definitely need homes that will take teenagers, and we need homes that will take sibling groups. You know, because we do not wanna separate children upon removal, we wanna, you know, keep the children together. So, folks who open their homes up to teenagers, and it is teenagers are teenagers, but I think people do see the rewards in doing that. But then, you know, little kids, sibling groups, sometimes it's a challenge in finding a home, you know, upon removal.
Thank you.
Okay, I wanna thank you. Any questions about any of the report?
And what we do wanna kinda just put a word out for is that we have a staff person, Dina Rodriguez, who kind of takes it upon herself every year to gather donations, you know, presents for the holiday time for children who the agency's involved in. So we would, be very happy to accept any, donations, toys, clothing.
How does
you know,
that work? Where do people donate?
Just to call, I'm gonna just put Dina's name out there, and I'm gonna tell her when I go back I did that, but.
Don't call till later.
She caught me early this morning to say, hey, I got a head start on it this year, and she works with local PPAs and doing that, so.
Is it for the holidays or is it ongoing throughout
Just
the
for,
year?
right now, we wanna focus on the holidays, and
Okay.
because what happens is, in using Christmas in particular, you may remove a child December 23rd or 24th, and they're in a foster home, and the foster parents are scrambling to try to, have something under the tree, and even just, having things under the tree for the, 98 kids. I mean, that's, if we could get any donations and you don't have to wrap them, we have little elves at work who wrap during lunchtime and after work. And obviously, we wanna see what the gift is, prior to,
It's
so.
appropriate, right. Okay, thank you for that.
So they can deliver, send to the agency, and we'll find a good home for the gifts.
Wouldn't it be easier if we had also a pickup or a drop-off here?
It'd be easier if we had a committee that, but if there was a drop-off here too,
A drop off here?
yeah.
Is that easy enough?
Yeah, we do something similar for another agency, not affiliated with the county every year, so we could do piggyback with them as well.
Okay, so where would they bring them, to your office here, Josh, or
Um,
how would we work that?
I would just have your employee contact Michelle, and they'll coordinate something, because she coordinates it for the building.
Okay.
We also
Okay.
work with United Way and Catch Agency,
Yeah.
a few other community agencies that, collect donations.
Okay. Thank you. Okay, the third report, Department of Family Services Staff Training Safety Measures.
That is something that you had talked about at the last committee meeting in terms of quality assurance, and, I mean, basically when we're looking at DFS specifically, we look at temporary assistance, we look at services, which is child protective, foster care, preventive adoption, we look at SNAP, formerly known as food stamps, Medicaid. I mean, these are all state functions that staff are performing. There are state trainings, core trainings that staff are required to attend, when becoming employed. Little bit of the, child protective staff, as an example, you have to have a basic core training as a caseworker, but then you have to go to a child protective core. In total, you have to really do 4 weeks off-site of training. Some of the difficulty is getting folks from when you hire them, getting them signed up and plugged into a core training right away that meets the schedule. Those are the basic trainings, but then there are trainings, additional trainings that we need, that have been identified. Many, again, with the state being, OTDA supervising the public assistance programs, and OCFS, Office of Children and Families, supervising the child welfare programs. They do program reviews, like the employment person we talked about earlier comes down, does a program review. The OCFS folks come down and do child protective program reviews, foster care program reviews. From those reviews, we come up with performance improvement programs, trainings get identified, et cetera. So, I mean, there's a myriad of different programs, of different trainings that are available. I don't know what else.
So just so that I'm clear, there was a discussion, that there's required trainings, and then there's trainings that could reduce error rates, for example. So because, like you mentioned before, there would be staffing cuts within some of the departments, there might be a higher error rate. So those trainings that would improve that piece is more what to focus on, quality improvement. I'm not exactly sure, what's available, above and beyond the core requirements.
And part of it is with training, there are different trainings available, but obviously we have to have a training budget, a training line, the ability to do that, that's part of an issue. The other part is having the individuals, the staff development folks to do the training, to do the orientation.
So do we do any of that piece now?
We look for local trainings, we look for inexpensive trainings, trainings that do not require overnight travel, hotel stay, that reduce the, travel time, expense for traveling, not as much as we should and we could and that we need to.
So, maybe for next month, we could kind of have an idea of what's available out there. I mean, if there's some kind of way that we could pull some of the training and to address that specific piece.
Many years past, you had a staff development coordinator. Staff development coordinator, oversaw the training needs of the department, right? There are state, training software packages where someone can go in upon hiring of an individual or employment and really map out what trainings are required and what trainings they would benefit from for each individual employee.
Right, so I understand, staffing cuts, but if there was a staff development coordinator position, wouldn't that indeed save money if they were identifying errors that, were being made?
I mean, if they're not necessarily going to be the individual in there, identifying the errors, but they can facilitate the training. And that is a proposed position and to reinstitute that in the budget.
Okay, so in the
for
tentative
15.
budget, Josh had said that position is there. So that person would be responsible to identify some of these
Yeah.
trainings to target over and above the core, okay?
Because in the child protective, you have domestic violence training, and you have advanced interviewing skills, and, with those 30 cases that go to the family violence response team, you have to have staff that are well-trained, who know how to investigate, who know how to interview, how to write assessments, develop service plans. Some of that is covered in the basic core, but, as you get into these cases, you really have to have certain competencies and you need to continue to build upon them.
Okay.
Does anybody know when that position was last filled? How long that position?
I remember Harriet Finkelstein in that position when I was out there in the 90s.
I thought that a woman was in that position and then retired, and I can't recall.
Correct.
Debbie Lyden?
So we don't really,
No.
we don't know how long it's been vacant.
Was it Lynn Albee?
Lynn Albee
Lynn Albee.
was the last training coordinator of that one.
7 or 8 years it's been vacant.
Okay,
So Lynn
so
was just a couple of years ago, I think she.
it looks like it is in the tentative budget, so hopefully, we can discuss that as well. Okay, we're gonna move on to discussions. Number 1, Office of Children and Family Services Blueprint. And I think that was attached to the
Yeah, I think
agenda.
in just in fairness of time, it is attached to the agenda. It's a document in draft form still, created by New York State Office of Children and Family Services. And we had an individual, our regional office person lined up to come today, and then she had it back out. Perhaps she could come in December and present it. It's really a document that for 2 years, OCFS has been working with counties, states, schools, and really it's their, values and vision statement and how they see child welfare operating across the state of New York. And there are, when it becomes in final form, I think what the state is going to do is to ask individual counties to embrace it, adopt it as much as possible. But I think it would probably, if we can have the state rep come in December and talk to it, that'd be more beneficial.
So from my review of it, it seems, logical document. It looks like what they're trying to do is to keep the family ties maybe more in the past and have shorter, separations from family. So that would affect your foster care program and.
Right, it's always from a federal and a state level, it's, you want to keep families together. You want children growing up with their mom and dad.
So
And
is this gonna set
that's
limits?
the ideal.
It'll set limits on the time that a child can, say, be institutionalized in therapeutic homes, or is,
I
That-
mean, they expect, so you keep them intact. When you can't keep them intact, you keep them with family, with grandma, grandpa, aunt, uncle, cousins. When you're not able to do that, you keep them in the most normal family-like setting, which means foster care. You only use residential, group home, et cetera, placement.
So you're already doing
We're-
that
we're
within the
doing
division,
that.
you're ahead of that
We're,
now.
I mean, they're just kind of putting it to paper and really, hopefully, you know, with it, it's a state initiative, money will come with it. I'm not, you know, I'm hopeful of that, I'm being realistic. But it's just, it's a blueprint, it's good for us to follow. There are many things we're already doing, there are things in here that maybe we are not, that we really need to consider doing.
Okay, thank you. Okay, Joe?
All right, I still got an hour to do this, right?
No, no.
Well, you know, it's such a small topic. The chair lady has asked me to do a little presentation in terms of behavioral health reform, as well as basically healthcare reform. So what I did was I put together a little PowerPoint. I'm gonna send it all to you guys electronically because the hot links actually work. So it can give you more background in terms of the things that we're looking at. You know, on the next page of the PowerPoint, you know, the forces of change that I've identified for us is the Affordable Care Act, the Olmstead decision, and the New York State plan around that, Medicaid redesign, and you know, New York State healthcare costs. The Affordable Care Act really talks about a triple aim. You know, the triple aim really is about better health care, better health, and lower costs. And many of the efforts that are found in the Affordable Care Act are all really about that. You know, how do we bend the cost curve? How do we develop better health for the folks in our community and better health care overall? And that's what it really seeks to do. The Affordable Care Act also created the exchange and expansion of Medicaid. It also allows for the development of health homes, accountable care organizations, and you know, electronic medical records. You know, there's some funding to be able to do that. These are all things that are currently going on in healthcare in New York State. One of the things that you're also going to find that's occurring in New York State is that you know, they're trying to break some of the silos of care. For example, we have people who come to our clinic for medication treatment only. They're not there for active talk therapy. They're not there necessarily for you know, some education around you know, what's going on in terms of their illness. They have all of that. Really what they're coming for is to get the psychotropic medication from our psychiatrist. You know why? Not because their doctor can't prescribe it, but because their doctors don't want to prescribe it. And we've quite often tried to get doctors to accept folks who had serious mental illness for, you know, just medication treatment, and, you know, quite often that person is refused. Well, the state is trying to change some of that, because there are folks who come to our mental health clinic that don't necessarily need to be there, and their health care is really the primary issue. And there are people who come to the mental health clinic who really need to be there, but they also have a concomitant health issue. New York State is looking at trying to co-locate those services, both behavioral health and physical health care, and they're looking at different models of trying to implement that. I'm not going to read through the rest of that, but the other thing that's really impacting behavioral health in New York State, as well as other things, is the Olmstead decision. For those of you who do not know about the Olmstead decision, Olmstead was basically a litigation that was brought into the state of Georgia, where these two women were kept in really an institution well beyond the time that they needed to be there. It was already decided by the doctors and the people who care for them that they didn't need to be there, but the state of Georgia said, no, we don't have any alternative locations for you, so you need to stay institutionalized. Well, the ladies won the lawsuit, so they're able to leave the institution. And based upon the Olmstead decision, they basically said that you need to have people living in a place that's appropriate to meet their needs, not to institutionalize people. The Olmstead decision then has forced other states to look at, you know, whether they're providing institutional care for people who have disabilities, and if they are, how do we get folks into the community? How do we reduce the size of those institutions so that it's appropriate to meet the needs of the person's disability? What's occurring in New York State now is that you're really starting to see that. You're talking about the Office of Mental Health and the Office of Person with Developmental Disabilities closing some of their institutions and trying to move people into the community so that they can live, work, and play in their community, and in reasonable housing. You know, the days of having a community residence with 12 people in it are going away. Right now, New York State is saying, I don't want any more than maybe 3 people, you know, in a residential opportunity, and less if we can. The Office of Mental Health is really putting a lot of emphasis behind supported housing and supportive housing, which could be just, you know, a scattered site in apartments or condominiums or whatever the case may be. So we're looking at different models, but Olmsted is you know, the decision is really pushing us to look at, you know, what are reasonable alternatives to institutional care. That actually is part of the aging issue too. Medicaid redesign. Well, Medicaid redesign, remember Governor Cuomo pulled together the Medicaid redesign team, and they came out with their recommendations. I had a hot link to that if you want to take a look at all of that. But really what Medicaid redesign looked at and is looking at now is how do we reorganize Medicaid and the use of Medicaid to better meet the needs of people in our community and in a holistic fashion. So really what we're talking about is a couple of things. Right off the bat, the state changed the rates for everybody. Healthcare, whether it's behavioral health or physical health. You know, and what that did immediately was create about a $14 billion savings for the state. The governor has now asked to be able, the federal government, if we can take that savings and reinvest it. And the federal government agreed to let us reinvest $8 billion over the next 5 years to be able to restructure healthcare. That's what's going on now. We have the Balance Incentive Program. We have the DSRIP program, which the acronym is in here. It's called the Delivery System Reform Incentive Payment Program. In Sullivan County, but you didn't know, we have 3 DSRIP proposals that are going out there. Lafua, Westchester Medical Center, and Montefiore. And what they're doing is they're putting together a provider system of which community services is going to be a part. We're going to be delivering behavioral health services for within that provider service. And they're really talking about breaking down the barriers between physical health and behavioral health. One of the ways that the state is looking to do that seriously is to try to create one medical record. You know, we've talked about, you know, the electronic medical records and how they're important, how they help us in terms of being able to provide better health care because now we have some understanding about what's going on. But what's happened is, you know, we don't really share that electronically. You know, for the most part, we get a fax from somebody and we pin it to our electronic medical record, or we send a fax off to somebody else, they pin it to their electronic medical record, and it's not real live data. What we're going to be looking at over the next 3 to 4 years is developing a live electronic medical record so that if I go into, you know, Catskill Regional Medical Center and say, you know, I need help with whatever, you know, they then can say, okay, can I look at your electronic medical record? I'll give them permission, and they'll be able to go ahead and see, you know, what my endocrinologist is prescribing me, what my general doctor is prescribing me, and any of the other stuff that's going on, as long as I give them permission. We are 3 or 4 years away from that really happening, but the plan is afoot to make that happen. And what's really important about that is if I go into the hospital in the ER and I can't speak for myself, they'll have the ability to break the glass and take a look at what my electronic medical record has to say to better help me get better at that point in time. So that's one of the things. That's one of the reasons. That's one of the things that they're looking to in terms of an effort, because then me as a behavioral health provider and the other physical health providers that are in my network can share that data, and you know everybody is on board in terms of the client care. Health homes. Right now we have health homes in Sullivan County. There are 2 of them. We're participating in the health home program. And really what health homes are is not brick and mortar, but it's really a system of care that's available for people through the auspice of care management. In the old days we used to call it case management, but now it's care management. And the care managers really, you know, not only are working, in the old days we had care managers for people with behavioral health needs, serious mental illness. Now we're not just dealing with serious mental illness, but their physical health overall. So we may have somebody, and to be eligible for a health home, you have to be first Medicaid, then you have to have two chronic conditions, one of which should be a serious mental illness or a disability, and the other which could be, hypertension, obesity, things like that. And typically you're going to be a high spending person. You're somebody who's had enough health care needs that your cost of Medicaid is probably 2 or 3 standard deviations above the average. Those people are referred for care management. They agree to care management. They develop their own plan of services with their care manager and their health care providers, and they're walked through until their health care is being addressed in an appropriate fashion. Then let me just talk a little bit about DSRA. Right now, the 3 programs that are trying to develop this incentive reform program are putting in applications to the state government to reorganize. And the applications are due in at the end of this year, and I believe the awards are sometime in March. Nonetheless, they're putting together a needs assessment of our communities, and we are part of that needs assessment. As we do local planning for behavioral health services, we have all that information. Nancy McGraw is part of that needs assessment because she has the local health services plan for our community, which identifies all of those needs. And together we've partnered with both Montefiore and Westchester Medical Center and Refuah to be able to deliver to them the information that we have. Why should they have to reinvent the wheel? What we're really talking about, though, is a different way of paying for services. There's $6.9 billion available in New York State to be able to reorganize health care, physical health and behavioral health. I'd like it to be just health, because at some point in time, you got to get rid of the differentiation. And I think that's where we're going. We're going to talk about wellness. If you let me do a discussion about mental health prevention, I would talk to you about wellness, not about symptoms. So really that's kind of where we're aimed. See if there's anything I really want to hit you. I did list some of the state and federal initiatives for you to take a look at, and then I alliterated all of them in here. And again, I'll send you the electronic versions because there's much more detail involved in that. But you go to the back page, and really this is what all of this stuff is doing, the federal and state regulations is doing is, we're looking at less institutional care, more emphasis on recovery, okay, because, it's all about learning more about your illness so that you can, manage your recovery from that illness and, be more productive and vital in our community. Integrated models of care. The state and the federal government have finally recognized that housing is a factor in your health care. Imagine that. So now we're actually seeing
revelation.
Now we're actually seeing an emphasis in trying to get people safe, sober housing, appropriate housing, one that you're not looking at lead chips for kids to eat and things like that. So I think that's great because that's what's coming out of this. And there's a real emphasis on community-based supports and peer supports. We just got that grant. Remember, we passed a resolution last month where we're going to fund the Independent Living Center to be able to put peers in place to be a warm handoff for people who are leaving the hospital who had just had a psychiatric break or whatever you want to call it, so that they can assist them to move through the community, make the connections they need for their care, and for their housing, and for work, or whatever recovery things that they would like to participate in. That's something unheard of. Just a year or two ago, you never got funded for peer support programs. Now there's a big emphasis on that because there's the value of that for folks. First of all, to work with somebody, a peer who's recovering from a serious mental illness, as an example for somebody who may not have seen an example of that in their life, is very important. And this is a person who's been through it, so they can help you get through it too. So we're very excited about that coming up.
Is the VA a partner in this?
we are partnering with the VA, but as an institution, the federal VA institution tends to be somewhat siloed. We have had folks come up from the Vet Center in Monticello, do some training with our staff in terms of, you know, how to work with veterans, people who may have suffered some type of post-traumatic stress disorder, as well as, you know, to kind of train us on how to work with vets in general.
Well, you brought up a good point when you said peer.
Yeah.
Because most vets who suffer, well, you call it PTSD, I call it shell shock.
Right.
They'll talk to another vet.
Yep.
They will not talk to anyone else.
Correct. And most vets don't want to go anywhere near the VA.
I know that.
So that's why we're trying to become a resource for some of the vets in our community too. The last little bit that I wanted to talk to you a little bit about, which is the major actual player in all of this, is that in the old, you know, a year ago, 2 years ago, if you had a serious mental illness or a serious disability, you were what they called straight Medicaid. You know, and for the most part, it was paid 100% state and 100% federal dollars. There's no local dollars going into it, particularly if you lived in an intermediate care facility, a community residence, or participated in day treatment programs. And that's the majority of the people who are living in developmental disability housing and some of the mental health housing. Well, now everybody's in managed care. Everybody knows what managed care is? It's an HMO, but with Medicaid. So what's going on now is we will be contracting with managed care organizations. We already have some of those contracts for payment, but now they're taking everybody. So what's the opportunity there is that your managed care organization has to make sure that they have enough behavioral and physical health providers to meet the need of their constituency. The bad side of that is that they're usually bad payers. You don't get a great rate out of it, and you know you have to go through. It's like pulling teeth, basically, to get paid. The fortunate part about some of that, though, is under the Office of Persons with Developmental Disabilities, their HMO is called a DISCO. Now, don't ask me what that acronym stands for, but they're looking at creating a couple of these managed care organizations in New York State. Probably 2 or 3 for the New York City area, and then probably 1 for the rest of the state.
Big surprise there.
Yeah, I believe. Well, and again, one of the things that's happened over the last year or so is I've become an insurance person. You know, because I've had to think about the number of covered lives and what is the attribution to our district in terms of whether we're going to be able to, you know, be financially viable and all of those things. The answer is yes, we can do that, but you have to take a bigger region in order to make that happen.
That was gonna be my question,
Uh-huh.
because I know we are running out of time. I wanna thank you for the information. It's a little over my head, but I guess my question is, it looks like the state is moving toward more, like a realignment of their funding, putting it more into getting people back on their feet and recovering.
It's
That's a
yeah,
statement,
we're
not a
trying
question.
not to collect people anymore. You know, the
Right, because
helping
some
profession was really
clients
great
would-
about trying to collect people, and what I try to tell our folks is, we don't collect people, we help them and we move them along.
But some clients stay, you know, in the program for
Right.
years and years. So this may move people beyond that.
Yeah, and there's been a real emphasis over the last, you know, decade really of being able to move people forward. And the field really has adopted the recovery model of services, which really talks about, you know, teach the person about their illness or illnesses, help them manage their illness or illnesses in the community, and move them towards, you know, life.
So how is that gonna impact on your department? I mean, as far as, I know, you would have individual, client therapy sessions, and now, are there caps being put in place now, and on groups
It depends upon
versus?
what the managed care insurance plan is, because as well as you may or may not know, there are really a couple of very large insurers in New York State, and they all have different insurance products. So depending upon the insurance product that you get, there may be caps associated with that or not.
Are you currently under caps now, that a person,
There are
because I
some
know
insurance companies that
in
do
the
have
past, in
caps.
your reports, if you read, you know, the caseload, I think, was pretty high, like
yeah.
60 clients per caseworker,
It's
but.
not quite that
What is it, the average per caseworker?
Right now, our social workers have an average caseload of anywhere between 30 to 50.
Okay, it was higher at one time?
It was up to 90 when I walked in the door.
Okay, so what my question is, I know with reforms through the state, are they putting caps on the amount of visits that a client can have?
The
I mean,
insurance
once a
programs
month,
will.
I understand, is
Right.
what New York State is proposing. So if it's once a month and a social worker has 40 clients, then that would be 40 visits a month. So that would be pretty
That'd be low.
easy to accomplish,
It'd
right?
be very easy to accomplish.
So is that what's happening now, or?
No, actually, what we're doing is we're treating the person and trying to meet their need. If they need to see us, once a week, we'll see them once a
So
week,
it's just a
twice a week, twice.
recommendation from the state
It's a
to have-
recommendation from the state, and again, it's the insurance companies that, even insurance companies that have caps, we can ask it where there's medical necessity for us to exceed those caps. And, we just have to prove the medical
And are
necessity.
there any caps on long-term treatment? I mean, or is it?
No, typically your caps are annual.
Kitty?
I wanted to ask a question when you were speaking about Montefiore and
Uh-huh.
those places. So, what does that exactly mean? Are we going to be getting people from the Bronx up here? Are we sending
Referrals.
people to the Bronx?
No.
What's the deal?
What the deal is, Montefiore is going, if Montefiore is successful in their application, then there's no reason why to think that they won't be, as well as Westchester Medical Center. What will happen is we'll just be part of their care network. So in other words, if somebody comes to us for some behavioral health care, we would be able to tap into Montefiore's physical health network, which extends way up here, and be able to have that person participate in whatever, physical health care needs that they have. We're just part of, it's almost like.
They're gonna
the-
go to a doctor there, the doctors up here are
No.
accepting that insurance? What does it actually
What
mean?
it actually means is that we're gonna be part of their care network. So you have to kind of rethink healthcare from, you belong to that hospital to it's an insurance program. So as part of the Montefiore DSRIP, what that means is if we're able to show a reduction in the number of unnecessary hospitalizations for the patients who are attributed to our network, then we will be able to take into the largesse of that. Some of that $6.9 million or $1 billion can come to Sullivan County Community Services because we're part of that network. And, some of that would be for, MIS and all of that. Some of it would be for training purposes. Some of it would be for, for pay for people. So we're really participating in, it's like another insurance plan.
But
And
like
just
Kitty's
another
bringing
comment
out,
that I have is when it comes to the medical electronic record. As far as I know, unless the rules have changed, every place can have a different format for the record. So it'd
Correct.
be trying to put a Ford together with a Volvo.
Well, not really, because what we're looking at trying to do now is we're trying to use the health information network that the state has created, or what they call the SHANE, and I know that public health is part of that network, as the kind of glue for all these electronic medical records. So what'll happen is my electronic medical record will talk to the state health information network, and what'll occur is that when I go up there to look at Kitty Vedder's medical record, current medical record, I'll have kind of like a go-between web-based system that I would mark, yes, I have permission to do this, and I would have to have an affirmation from you to say that I could, and I'll be able to look at the doctors you've recently, who are under their care, and what their diagnosed condition is, as well as medications and treatment recommendations.
Because all offices have different medical
yeah,
electronic systems.
this is like
The hospital has a
herding
different,
cats.
it's like,
Yeah, but what they're really looking to do is to try to create one repository and then give us the ability to pull up what they would call a dashboard.
Okay, Joe, I just
To do
wanna
that.
kind of, we can continue the discussion next month,
Mhm.
because I know there's a lot of information to review. And I wanted to thank you for the resolutions from the NISAC conference.
You're
And would you recommend that we review these and possibly pass these through the board? Is that why you pass them on?
I think those
Okay.
are
So I
pretty
think
important.
they're attached to the agenda, if everybody could review them, and I'll discuss with Josh if we could pass some of those at full board. Okay, There are no resolutions, but I do want to give the other departments an opportunity to contribute. Giselle?
I just wanna, mention our heat season home energy assistance program opens November 17th, 2014. This year we partner with United Way and the Hudson Valley 211. So that's been up and running, it's been working great, they've been getting calls, questions about applications and emailing us, so people can start calling 211 from a landline or any mobile phone in Sullivan County. They are working. They can access benefits and apply online. To apply online, so they don't have to come into the local district. The website is mybenefits.ny.gov. And again, they can apply online starting November 17th. Some people that have already received HEAP benefits last year or received food stamps and temporary assistance have already received their applications in August. So they have to get those back. Anybody who falls in that category that has not received an application, we have had some inquiries and have already been able to figure that out. So we're trying to do as much as we can before the 17th. If they call 211.
My benefits.
mybenefits.ny.gov.
Thank you.
If you call 211 now, they'll answer any questions. You can request application to be mailed to you from them. And also, we work with MIS and our website is updated with all information for 2014, so.
Thank you for pulling in 211. I think it's really easy for people to remember that. Okay, any other questions? Lesha, quick?
If I could just have a minute. October was a very busy month in Sullivan County with many fun, safe, family-oriented Halloween events taking place. Some of the programs that the Youth Bureau funds that had their annual Halloween parties was the town of Bethel, Coshocton, Fallsburg, and Mammoth-Katy Youth Recreation Programs, as well as the YMCA program. The YMCA program joined together with EPIC, Every Person Influences Children, and had a very big Halloween event here at the Monticello Elementary School. The event was open to all youth of Sullivan County. Approximately 600 individuals attended the event. There was a safe trick-or-trunk where Halloween candy was dispersed to the kids, followed by a haunted forest, and then there were games in the auditorium for the children to play, and they won prizes when playing the games. The town of Mammoth-Katy also had a very large Halloween party. I would say approximately 200 children attended the party. There was a parade followed by free hot dogs, sundaes, and beverages for the kids. There were free hay rides, a free haunted house, a free pumpkin patch where kids received free pumpkins, and it was just a great event as well. Besides that, Michelle Huck from the Office of Management and Budget had a safe trick-or-treat here at the Government Center. Approximately 150 Head Start students came here. They were bussed in by buses, and they went from department to department trick-or-treating, and they accumulated quite a lot of candy that day. And they were really happy.
I saw you at the firehouse, the
Yes.
Hurleyville
Yes.
Halloween parade.
Yes, the Hurleyville Fire Department had its annual Halloween parade. This has been an annual event for many, many years. I moved up here 20-something years ago, and I've attended every party since I first came to Sullivan County. They had free hay rides for the kids, donuts, and beverages. And also, every kid got a 50 cents piece for winning best costume, most funniest costume, etc.
Thank you, Asha.
And one more thing, the Sullivan County Community College had a very large Halloween event as well. It was a safe trick-or-treat. Kids were brought into the building, and they went from department to department inside the college trick-or-treating. And I think it's also a great way to expose the kids to the college, so that they know we do have a college in Sullivan County and the different departments that are in the college and what they have to offer. So there were a lot of good things happening.
Okay, is there any other public comment? Okay, I am calling an executive session. It is information relating to a current investigation, item C.
I need a motion in a second. Jonathan, Kitty.
Are you gonna do any business when we come out of?